Welcome to Dateline Health. This is Fred Lippman coming to you from Southeastern University. This is going to be a very topical show. We usually talk about health, cardiac health, cancer, et cetera, but every once in a while we talk about things that are the health of the community. And today we're going to be talking about mental health. And what better time to talk about mental health than, unfortunately, at this point in time when our community has been scarred with a disaster at Marjorie Stoneman Douglas High School. Let me introduce our two guests. Right in front of me is a longtime participant here at the College of Psychology in Southeastern University, and that's Dr. Ralph Gene Cash.
Right.
And he is a director of school-related psychological assessments and clinical intervention clinic, a very important topic that we'll be talking about today. And of course, Paul Jaquith, who is obviously you're a licensed social worker.
Licensed clinical social worker, right. Yes.
And you're the president and CEO of the Mental Health Association of Southeast Florida. Doctors, gentlemen, thank you for being here.
Thank you.
Thank you for the opportunity.
Okay, I'm going to start with you, Paul, if I can call you Paul.
Sure, that's fine.
It's difficult times throughout the nation, and it's a difficult time when people want to point fingers and say it's because of this or because of that. But I thought that after talking to a lot of the folks at the Broward County school system, that the mental health issues should be addressed right out front. Mm-hmm. So let's talk about it.
You know what? It's not any one answer, and it's not any one problem. Mental health issues and mental illness is certainly a component of it. It's interesting, when I was first asked to be on this program was before this incident occurred, and prior to that, we were going to talk about stigma and what did it mean to be labeled, if you will, with a mental illness, and what it means to those people that get identified with a mental illness. And now here we are as a result of this horrible event that happened a little over a week ago, where mental health and mental illness has been stigmatized at a greater level than one can even imagine. It is astounding at how quickly the person responsible for this shooting has been demonized. Not just that one person, but an entire community. Anybody that could be considered mentally ill is going to be tarnished with this discussion about how dangerous people with mental illness are. Nothing could be further from the truth. In fact, people with mental illness are more likely, statistically, at a higher rate to be the victims of violence than be the perpetrator of violence. That does not get discussed really in the media. It really becomes, the finger gets pointed, see, this is a person, and I was watching a program last night, this community forum, and someone is talking about the insane monster and the insanity, and it's like this whole morality message is coming across about people with mental illness as if they are to be feared. So here we have been working in our organization, I know in the community, to get people to talk about what it's like when you start to get those feelings and you start to feel the experience of a mental illness. People don't go to get help because of the stigmatization, so that they stay away from getting help because they're trying to push it away. Now, my concern is we're about to see that whole push go further and further back. We've come a long way in this country in terms of acceptance and getting people treatment who need to get treatment and getting it in an effective way. Now I'm worried about what the message will be. It's really distressing.
Dr. Gene Cash, you've been through a lot of these ups and downs in the whole element of mental illness, but really the whole spectrum of psychological services, assessments, interventions, etc. What's your thoughts?
Well, my thought is that we have a very complex problem, Dr. Lippman, and a wise man once said that for every complex problem, there's a simple solution that doesn't work. So we have to have a complex solution, a different approach than we've used so far. And I think that a three-pronged approach is really important to the problem of societal violence and violence in schools and violence against the self, too, suicide. But the first element of that approach, that solution, in my view, should be education. Education of school personnel, education of students, education of their parents, education of the community to look for signs that somebody might very well be violent, and to be willing to report those signs to people who know how to do something about it. The second part is to have more mental health providers and more readily available mental health services in schools and in the community. And if we don't do that, then of course we end up demonizing people with mental health problems, and we don't do effective prevention. And the third thing is that we should be working on restriction of access to lethal means for those who might very well be violent.
Paul, is that the issue really is that we shouldn't be looking to stigmatize anyone. We should find out what the problems are. You know, we need to understand that mental health is a disease.
Mm-hmm.
Here's the thing, if I could just interrupt you for a second. You know, as far as I'm concerned, I really don't even want to know who the shooter is. I don't want that information, in a sense that, think of it this way, someone who's been marginalized, someone who feels powerless, someone who's been perhaps bullied, or someone who has in some way been kind of shunned aside by society. What better way to get back, to make a name for oneself, than to go out, if we can, pardon the pun, a blaze of glory, by taking out multiple lives in one horrific act, and then having your name and being talked about. And while we know in the psyche of the person that that's the fantasy, that somehow or other it will make them feel more powerful and bigger and see what I can do, when in reality what it does is it just creates more harm and destruction, obviously, for these families that are left with I can't even imagine the utter destruction that's happened in their lives. You know, when I get up in the morning and I make my breakfast, now for the last week, I think to myself, if that was my son, and I'm having breakfast in the morning and I'm making him breakfast, and I think, what would I do if all of a sudden our lives had changed like that because of the act of one person? So as much as the act itself, I understand the role of the media in reporting it, but I think there's kind of, unfortunately, there's an alliance, if you will, when we get to the barrage of reporting that goes on, and that we need to know more and more and more about what the shooters, you know, what was behind all this. I think that we really do a disservice, because I believe that what it does, it further kind of reinforces for those people that are feeling powerless and feeling they've got nothing left than to go out in such a horrific way, that we're giving them the opportunity to do that. We've got to do something to stop that opportunity so that it doesn't exist for people. And I agree. It's not a one answer problem. There's a lot of things that we should be doing, and we should be doing differently. And you know, as we go through this and we find out more and more about the background of this individual and the losses in his life, and that probably drove him towards making these decisions. But and I don't know what was the event was over in less than 10 minutes. I mean, these families, our community, for years and years and years, are going to be dealing with the aftermath of this. For years. It's not going to be over in 6 weeks.
Dr. Gene Cash, you know, like I said, these disasters are horrific.
Yes.
There's an answer to a lot of these things, and I just wondered, because I know that you've been such a strong advocate of trying to entice and educate the general, shall we say, governing complexes, whether they be school boards or city commissions or county commissions or legislatures or congressional people, to the fact that we've got to pay attention to mental health funding. Let's talk about it.
Okay, let's do, because I certainly am a public policy advocate. I believe in public policy advocacy. In fact, I believe that those who do not engage in public policy advocacy are not at the table, they're on the menu. And as a result of that, it's very important for us to look at what we're doing here in our state, in Florida. The per capita expenditures on mental health services in Florida are 49th among the 50 states in the United States. If we counted the Washington, D.C. and Puerto Rico, we would be 51st among 52. That's unacceptable. It's well, I won't say criminal, it's a mistake. It's a large mistake. We need to fund mental health services, and we need to recognize that funding mental health services will help those who suffer from mental health issues to become productive, capable parts of our society. You talked about the use of psychotropic medications before. Certainly psychotropic medications can help, particularly when combined with psychotherapy, and people with mental health problems typically are not violent, but they tend not to be productive unless they get the help they need. Once they get the help they need, many, if not most of them, can be effective, productive, non-violent citizens.
I'm just wondering, in your long-standing advocacy for mental health funding and your responsibility as the president and CEO of the Mental Health Association, where do we go from here?
I think that we should look at Salt Lake City. Salt Lake City has a program of providing housing for the homeless. And does that take care of mental health problems among the homeless? Not in and of itself, but it not only gets the homeless off the street, but it also gives them a chance to access other kinds of services that ordinarily they would not be able to access if they're homeless. And the results have been strikingly positive in Salt Lake. It has been so worth their money to provide some basic, fundamental, humane services to people who are struggling. And instead, here in South Florida, we don't allow organizations to feed homeless people on the street, because I don't know why. I can't figure that out. But if we take reasonable, humane approaches and we provide effective mental health services, people who are homeless and who struggle with mental health problems can end up being productive citizens, as I mentioned before.
What do we do now? I'm sorry. Go right ahead.
The other thing is, I always say, follow the money. So when deinstitutionalization was introduced as a concept, it made sense. It made sense. The agreement was, as we all understood it back in the 70s and into the 80s, was we shut down these large institutions where basically we're housing people with mental health, with mental illness, to release them into the community. There would be funding set up in anticipation of that for community mental health centers, housing, medication, providing mental health supports, psychiatrists, psychologists, social workers, whatever. That never happened. Consequently, what happened was the doors got opened, closed behind people, pushed out, given nothing. They were to fend for themselves. Now, I'm a reasonably intelligent person. My kids don't always agree with that, but I think I'm reasonably intelligent. I know to navigate a system with what I know to be a very challenging system, just because it's the enormity of it, and where do you go, how do you get to these services, is a challenge. Can you imagine what it's like for someone who's hearing voices, or someone who's so depressed they can't get up in the morning? I mean, to me, the folks that need the most intervention are the people that are getting the least intervention. As Dr. Cash said, we are number 49 in the United States, and not just this year. We have been for years. For years, we've been at the bottom of the barrel in terms of funding. My community partners step up to the plate time after time, providing services, evidence-based practice services. They provide services that are quality, high quality, but they can only do this much when the need is this big.
Let's focus a bit about the students that are in these schools. You know, there's been so much talk about social media and bullying and things of that nature. Well, let's get your take on that, Dr. Gene Cash. What do we got there?
Well, social media is very much like atomic energy. It can be really good, or it can be really destructive. And we have had to coin a new term in the last few years, cyberbullying. Cyberbullying is using technology, like social media, to denigrate somebody else, to marginalize somebody else, to ridicule another person. And kids do that. That's unfortunate. We could talk forever about where kids learn to do that, but the fact is that they do. And that's a problem that we have to deal with. But bullying in general leads to negative behavior. Bullying is a negative behavior, and it leads to negative behavior. What we find about kids who perpetrate cyberbullying is that very often they are what we now call bully victims. That is, they have been victims of traditional bullying or sometimes cyberbullying themselves, and so they bully others. So it's very important that we find ways to reduce the bullying, and those ways, by the way, are not simplistic. You may have heard of the Norwegian researcher Olveus. His program works great in Scandinavia, although less so recently, but his program works great there. It doesn't generally work in our schools here because they're so diverse, because we're a different culture than the Norwegians. And so we have to come up with creative ways, and we are, for reducing bullying in schools. And if we can reduce bullying in schools, then I'm convinced that that will also help to reduce the motivations for school violence. Because the Secret Service report about Columbine and subsequent school shootings demonstrated that most of those shooters were victims of bullying prior to becoming school shooters. And we have bullying not just in elementary schools, middle schools, high schools in our country. We also have bullying in colleges. We have bullying in graduate school. We have bullying in the workplace. We have bullying virtually everywhere. And I'm convinced that a significant part of creating that bullying is the problem of domestic violence. So I read the literature about domestic violence because I frequently do talks about domestic violence. And I'm convinced that if we were able to eliminate domestic violence in this country, we could eliminate at least 50% of the behavioral and learning problems that we have in our schools.
You know, I always talk about the fact that we have the highest percentage of people over the age of 85 in the United States living in the state of Florida. We have the highest number of people over the age of over the age of 75 in the United States, and over the age of 85 in number in the state of Florida. But what people forget is that we're not only a retirement state, but we're a young school state. For example, the 3 counties that we're encompassing right here in South Florida, Dade, Broward, and Palm Beach County, 2 of the counties are within the top 5 school districts in the United States. So we have a lot of young people. So how do we inculcate within what people are looking for to establish some kind of mental health counseling inside of our school systems?
Well, I think, first of all, I mean, I could speak to the Broward school system, and the Broward school system, in my experience, is they have a rather robust system of care. They do identify children that are at risk, but it's, again, it's, this is how much they have, and this is what the need is. So, like anything else, if you follow the money again, the money is not there to provide the amount of intervention that's required for the amount of need. So the school system is, to me, only a microcosm of what our whole society is dealing with, what our whole community is dealing with, is the need far outweighs what the capability is to meet that need. So until things start to change in terms of funding and getting opportunities for people to receive the services they need, which is one thing. The other is the stigma issue where people are driven away. Do you know that when, the average age when someone starts to typically experience a severe and significant symptoms of mental illness is between the ages of 17 to 23, right? So it's a college age, late high school, into early to middle college. So that's typically when, that doesn't always happen that way, but statistically speaking, it typically happens that way. When someone first starts experiencing symptoms, the average length of time they wait before they seek any treatment or assistance is 7 years. The average. That means 7 years worth of damage has been going on. So until we get serious about how we view mental illness and see it as, it's 1 in 4 people. 1 in 4 adults are affected by a mental health diagnosis. So, if I went and said to you, hey, listen, there's a new lottery. The Florida State Lottery just introduced, and you'll be guaranteed 1 chance of 4 to win $1 million. We'd be gone. We'd be buying tickets like there's no one's business. But when we say that the opportunity to develop a mental illness is 1 in 4, the 3 of us who think, well, that's not me, that's not going to happen to me, I mean, it's magical thinking. It doesn't make any sense. Statistically speaking, it makes no sense. And yet, we still have this way of alienating anyone that has a diagnosis. I mean, it really prevents people from getting help.
And school psychology in the state of Florida, there are a number of school psychologists in the state of Florida. The ratio is about 1 school psychologist to every 2,000 kids in our state. The ratio recommended by the National Association of School Psychologists is 1 to every 500 to 700 children, students, depending upon the severity of their problems and whether or not this is a special school for emotionally handicapped kids or whether it's a general education population. Most school psychologists are assigned to 3 or 4 schools instead of 1, and that means that they're itinerant. They have to go around to 1 school a week. That's not enough. That's not enough to take care of the mental health needs that our students have. About 20% of our students statistically will have a diagnosable mental disorder, and about 10% of those will need very specialized help.
So what I'm hearing you say to these folks that are out here that are interested and are dramatically impaired and sensitized to this brutal slaughter that just occurred up at Parkland. What you're saying is we need you, the viewer, and your children and your loved ones to seek out an increase in attention to the financial support of the mental health systems that are already in place, but they need to do, instead of 1 for every 2,000, maybe kids, it's got to be maybe 1 for every 1,000. Let's start there. or one.
It's a good start.
It's a good, whatever it is. So that's what I'm hearing. Is that right, Dr. Gene Cash?
Yes, that is right. And I would say one other thing that I would implore people to do, and that is vote. Vote for the candidates whom you believe, honestly, will do the right thing for those with mental health problems, for our schools, for our education, and for funding for mental health and education.
We're down to the last 35 seconds of this show, Paul, so have at it.
Well, I think I agree. Dr. Cash said it perfectly. I think that our community is in crisis, and I don't just mean Broward County. I mean our community of humanity is in crisis, and we have been for so long, and too many of us, particularly people who have had the opportunity to make changes, have ignored it. I just hope, I pray, that this time will be different and that it will cease.
Yes.
We've got to stop.
Well, thank you both for being here. I know it's a difficult subject, and it takes a lot more than just 29 minutes to examine it, but I think you made your points. Paul Jaquith, the President and CEO of Mental Health Association of Southeast Florida, thank you for your advocacy. Thank you. Advocates are blessed people. Thank you very much. And Ralph Gene Cash, otherwise known as Gene around here, Dr. Gene Cash, who is an incredible human being and has spoken out brilliantly in his areas of psychology. Thank you again for being here. And if you have any questions and you have any comments, please give us a call or send us on an email. We'll get them to them. And thank you very much for showing up one more time. This program is called Dateline Health. We come to you from Nova Southeastern University, and as I said, this is your show, and that's why we brought this subject matter right up to you in your home. Thank you very much. My name is Fred Lippman. Until next time, see you.